How did polypharmacy evolve for bipolar mental health? Polypharmacy in bipolar disorder has developed over many decades, reflecting advances in medicine and the complex nature of the illness. It all started before the mid-20th century, when treatment options were limited to basic sedatives and chemical agents like bromides and barbiturates. These drugs helped calm agitation but didn't target the core mood symptoms effectively. Then, in the late 1940s, John Cade introduced lithium as a treatment for bipolar disorder. Lithium was a breakthrough because it was the first medication shown to stabilize mood and prevent manic episodes. This marked the beginning of the modern era of targeted pharmacological treatment. As time went on, researchers discovered more medications that could help manage different aspects of bipolar disorder. Anticonvulsants like valproic acid and carbamazepine were introduced because they showed mood-stabilizing effects, especially for patients who didn't respond well to lithium. Later, lamotrigine was added to the list, mainly helping with depressive episodes. The development of atypical antipsychotics such as olanzapine, risperidone, and quetiapine expanded options further. These drugs proved useful not only for managing manic and mixed episodes, but also for maintenance therapy to prevent relapses. With more medications available, clinicians began combining them to better address the diverse symptoms of bipolar disorder. Patients often experience mood swings, depression, mania, psychosis, and sometimes other health conditions. To tackle this complexity, doctors started using multiple drugs together, which is known as polypharmacy. Data from the late 20th and early 21st centuries show a clear rise in this practice. For example, studies from the 1970s to the 1990s reveal that more patients were receiving 3 or more medications at once. By the 2000s, it became common to see combinations like lithium with anticonvulsants or antipsychotics, especially in difficult cases. Several factors drove this trend. First, bipolar disorder often needs treatment that targets different symptoms and phases of the illness. Second, newer medications with unique mechanisms of action allowed for more personalized treatment plans. Third, increased awareness and expanded diagnostic criteria meant more people were diagnosed and treated, often with complex medication regimens. Fourth, doctors also needed to manage other health issues that often come with bipolar disorder, like anxiety or sleep problems, which added to the medication list. However, this rise in polypharmacy isn't without concerns. Taking multiple medications can increase the risk of side effects, drug interactions, and challenges with sticking to the treatment plan. Studies have shown that when patients are on more than 3 or for psychotropic drugs, they face higher chances of adverse effects, some severe. That's why careful monitoring and personalized treatment are so important. Overall, the evolution of polypharmacy in bipolar disorder reflects both the progress in psychiatric medicine and the ongoing challenge of balancing effective treatment with safety. Always remember, managing bipolar disorder with medications should be guided by healthcare professionals who can tailor the approach to each individual's needs.